So some of the tips for ongoing management, that care management touch point is really important. And if you have a care management that manager, that is wonderful. Some practices are small enough that they really can't afford a care manager, but there may be a staff person who is interested in the role of doing this. And that person can really be trained. It's often a person in your staff who has had either behavioral health issues themselves or with their children, and they're interested in this. And you can really groom somebody in your office to be that person who is the touch point for the kids and the families in your practice. Your list of resources, really, really important. And I'm going to give a shout out to Susie McNulty, who is our managing partner at Miabella Pediatrics, because she has an extensive list of who our therapists are, who are the psychiatrists, which ones take insurance, which is a big deal in Southern California, what insurances do they take, what are the lists of intensive outpatient programs, partial hospitalization programs, and residential programs, because we are seeing far too many of our kids who need to be going there. And we know after the first couple of visits that they're going to need more than what we're going to be able to provide for them. And in that case, working with your care management touch point, but really, again, giving the list of these programs and getting families involved in already looking for that next level of care is important.
I'll talk more a little bit further into this presentation about the collaborative care model, but just having your electronic medical record track these patients to some extent. Either you can do it kind of formally, where you give them a diagnosis of depression or anxiety, and therefore enrolls them within your EMR in some type of care plan, where then you can establish criteria, or you just, keep a HIPAA compliant spreadsheet of some sort, where you are just making sure that these patients are not falling through the cracks. The collaborative care model is kind of that one step up, like Colleen was saying. There comes a point where it just might be exceeding what you are capable of and what community resources are available to you. And so my office is literally this month partaking in a program with our physician organization to enroll patients in a collaborative care model. So I'll speak more to that in a bit.